Thank you. Good afternoon. We're going to start with First Minister's questions. I would just begin reminding members, as always, to observe social distancing when in the building, and particularly when moving in and out of the chamber, as this does cause concern if we don't observe it. Now, before we actually turn to the questions, I believe the First Minister will give us a short statement updating us on the Government's response to coronavirus. First Minister.
Thanks, Presiding Officer. Let me start with the usual statistical update. As at 9 o'clock this morning, there have been 14,751 positive cases confirmed, which is an increase of 96 from yesterday. A total of 1,443 patients are currently in hospital with either suspected or confirmed COVID-19, which is a decrease of 4 from yesterday. And a total of 53 people as of last night were in intensive care with confirmed or suspected COVID-19, which is a decrease of 6 on yesterday. In the last 24 hours, though, I'm afraid that 50 deaths have been registered of patients who had been confirmed as having the virus. That takes the total number of deaths in Scotland under that measurement to 2,184. National Records of Scotland has also just published its more detailed weekly report. Unlike the daily figures, that doesn't just include those with a confirmed laboratory diagnosis of COVID-19. It also reports on cases where the virus is entered on the death certificate as a suspected cause of death or as a contributory factor in the death, but where no formal test was carried out. The latest NRS report covers the period up to Sunday, the 17th of May, 3 days ago, and I would remind members that at that point, according to our daily figures, 2,105 deaths had been registered of people who had tested positive for the virus. However, today's report shows that by Sunday, the total number of registered deaths linked to COVID-19, confirmed and presumed, was 3,546. 332 of these deaths were registered in the 7 days up until Sunday. That is a decrease of 83 from the week before. Indeed, this is now the third week in a row in which deaths have fallen. Deaths in care homes made up 55% of all deaths linked to the virus last week, which is down from 57% in the previous week. And the number of deaths in care homes from COVID also reduced again. However, as all of us will agree, that figure remains too high. The total number of what are called excess deaths, those above the 5-year average for the same time of year, also decreased from 401 to 351. We've also published today further information from Public Health Scotland, which includes preliminary, and I stress preliminary, analysis of COVID cases amongst minority ethnic communities. While the data is very limited and further analysis is being undertaken, particularly due to findings in England and Wales, the current analysis in Scotland appears to show that there is not a higher level of COVID cases than would be expected given the size of our Black, Asian and minority ethnic population. I know that none of these statistical patterns will ever console those who have lost a loved one to this virus, Presiding Officer, and my thoughts and sympathies are with each and every one of them. But the trends we are seeing do matter, and they provide further grounds for encouragement. In particular, the number of COVID-19 deaths has fallen for a third week and are now almost half the level of 3 weeks ago. Deaths in care homes and excess deaths have also fallen. Tomorrow, I'll make a statement and publish a route map about the steps we take and the order in which we might take them to carefully and cautiously return to some form of normality. But of course, for the moment, the message in Scotland remains the same. Please stay at home except for essential purposes such as exercise, going to essential work that can't be done at home, or accessing food or medicine. People can now exercise more than once a day. But when you do leave the house, please stay more than 2 metres from other people and don't meet up with those from other households. Please wear a face covering if you're in a shop or in public transport, and remember to wash your hands thoroughly and regularly. Finally, if you or someone in your household has symptoms of COVID-19, then you should stay at home and isolate completely. Today's figures, Presiding Officer, show that all of this is making a difference. It is slowing down the virus, it is protecting the NHS, and it is saving lives. And as I will outline further tomorrow, it is helping to bring forward the time we can start to ease these restrictions. So my thanks go, as always, to everyone who is complying with these restrictions and helping us make this progress.
Thank you very much, First Minister. Now, just before we turn to questions, any member who wishes to ask a supplementary, I'm going to take all the supplementary questions after question 8. You can press your button at any time, but I'll take all the supplementaries after question 8. First question, Jackson Carlow.
Presiding Officer, the confirmation of the number of those who have lost their lives to COVID reminds us again of the enormity of this tragedy. And I wonder, in the light of that, whether the First Minister now accepts that keeping the Nike conference outbreak a public secret was not the right course to take.
First Minister.
I really do challenge that terminology, and I think, and I say this with deep regret, because I don't believe any aspect of our handling of this crisis should be political, but I do believe terminology like that is seeking to make it political. I covered this at some length yesterday, and I'm very happy to do so again. The cases from the Nike conference were all reported in the normal way through our daily figures. The reason that we didn't say where these people got the virus was down to patient confidentiality. At that time, the numbers of cases were very low, and the total number of people from Scotland attending that conference were also very low. And therefore, to have said that would have risked identifying them. I think almost certainly would have identified these individuals. But that does not take away at all from the public health management of the incident. As is normally the case in these situations, an incident management team was established. They took all appropriate steps. They are experts in these situations. They took all appropriate steps to contact trace and to do everything they thought was required to protect public health. More than 60 contacts were traced in Scotland. I believe more than 50 were traced by Public Health England south of the border. And at any time, if that incident management team thought anything further was required, including public notification, they had the powers to do that. So that is the situation, and I believe that while it is perfectly legitimate for people to question whether patient confidentiality should have been such a big factor, and whether, as we go through these kinds of epidemics, it continues to have so much weight, it was a legitimate factor at the time. My final point, Presiding Officer, and the scientists working with Public Health Scotland are doing further work on looking at the particular strain from this conference. But my final point comes to the terminology of secrecy, or, as others have said, cover-up. Apart from asking why anybody would have wanted to cover this up, I would say if that is the accusation, it doesn't just impugn my integrity. Opposition politicians are entitled to do that. But it actually starts to impugn the integrity of the experts who managed this outbreak, including, I have to say, Public Health England, who were part of the incident management team. So let's talk about these things seriously. Let's look at where there are legitimate issues and questions, but let's not engage in ridiculous language of secrecy or cover-up.
Jackson Carlo.
Presiding Officer, the public were not told. And as has been confirmed at Westminster in the four-nation agreement, it was also agreed explicitly that it would be the responsibility of the nation in which the outbreak occurred to take responsibility for the public dissemination of that information. First Minister, clearly this was the wrong call. The public should have been told. And if, as the First Minister still seems to be saying, it wasn't a mistake, then why is our Health Secretary now giving active consideration to making a different call if this kind of thing happens again? People need to know what the Scottish Government will do should the virus be found in this kind of public location in future. So can I ask, if and when contact tracers confirm a positive case over the coming weeks, and we discover that person has been in a public place where close contact may have occurred, like the Nike conference, will the public be told?
First Minister.
Well, as the Health Secretary said yesterday, indeed, as I covered in the daily media conference that I did yesterday, as you go through a situation like this, as the numbers of people with the virus increases, then issues of patient confidentiality, the considerations around that change. When you are at the start of an outbreak with very, very small numbers, there are clearly different considerations about possibly identifying people. Let me just repeat again, there were only 10 people from Scotland at this conference. Now, when we reported, as we did, that ex-patient from Y Health Board had been confirmed, had we also said where that person had got the virus, we would almost certainly have identified them, because they were probably the only person from that health board who were at that event. Now, that becomes a different consideration when you are further into an epidemic and the numbers of cases are different. That is why, as we go into test, trace, isolate, yes, of course, we look at the circumstances in which, where there is a cluster of cases, that is made public, and that is exactly the work that is rightly and properly being considered as part of the development of of test, trace, isolate. There are standard protocols and procedures for dealing with outbreaks like this. But let me stress a really important point here that I think perhaps sometimes it is convenient for some people to forget. The incident management team, had they thought that as part of the public health management of this, a public notice was required, they would have had the power to do that. They took the steps that were appropriate, in their view, as experts, to manage this from a public health point of view, and that is the normal way of dealing with virus outbreaks like this one, and I have confidence in the way Health Protection Scotland and these incident management teams operate.
Jackson Carlo.
Presiding officer, we now know this was a conference in a hotel full of other guests and staff who engaged with those delegates. The First Minister has said that there is a balance between patient confidentiality and public health, but for me, and I think most people, for coronavirus, that balance must clearly be tipped in favour of protecting the public's health. I think the public, and indeed most who have had the virus, will take the view that they do have a right to know, so we can all work together to beat this virus, and this gets to the heart of the matter. Contact tracers can do a lot, although it would be reassuring to know there were more of them in place. It didn't happen with Nike in Edinburgh, when it clearly should have. But, well, it didn't happen. The First Minister is intervening from a sedentary position, but it's perfectly clear from the litany of organisations who were at that conference that it absolutely did not happen, whatever the First Minister asserts. And this comes to the heart of the matter of the First Minister in the abstract accepting that mistakes can be made, but never in the specific. This was a mistake. Surely the job over coming weeks will be made much easier if the government is completely transparent about when and where outbreaks occur. In fact, it's essential that they do. Will the First Minister now give that commitment?
First Minister.
I think I did give that commitment, that consideration would be at the heart of our approach to test, trace and isolate. But, you know, I really do, on behalf of the public health experts who carried out the management of this situation, I feel I really do need to point out contact tracing did happen. They would have traced the contacts that they thought were appropriate to trace. Remember, there is a definition of a contact that will not include everybody that a confirmed case would have come into contact with for a fleeting period of time. And as I said earlier on, there were more than 60 contacts traced in Scotland. There were more than 50, as I understand it, traced in England. So there was an extensive contact tracing operation underway. And I come back to the point I think it's really important for people to understand. It is not me, it's not the Health Secretary, it's not rightly any politician who decides when an outbreak is being managed, who gets contacted and who gets traced. That is for experienced people used to dealing with these situations to do. And I have confidence in how they did that. I can tell the Chamber, though, that scientists working with Public Health Scotland, as part of their monitoring of this virus overall, they're doing work on the molecular sequencing of the strains of this virus in Scotland. And one of those strains they're looking at is the strain associated with this conference. Now, this is highly technical work. It's certainly beyond my expertise, but I'm advised that when that work is completed, it will actually tell us whether these cases, the ones that were known about and reported, contributed to any wider outbreak, or alternatively, if the public health management prevented onward transmission, as we believe will be the case. So as that work is completed, I'm sure we will be happy to make the conclusions of it known to the Chamber and indeed to the wider public.
Jackson Carlo.
Presiding officer, last week when I asked the First Minister where responsibility lay, she said explicitly responsibility rests with her. Now it seems when it's convenient, responsibility rests with public health officials. Part of the reason why we need to hold this government to account is to try and avoid further mistakes. And on that, it's clear the government does not yet have the plan Scotland needs to tackle the crisis effectively. A testing system that's only delivering at 1/3 of its capacity. That's a failure. Crisis in Scotland's care homes and still not enough tests for staff and residents. That is a failure. And no clarity on how or even if the public will be told about future outbreaks. Again, that is a failure. Does the First Minister not see that these are the things she must deliver on if we are to beat the virus, and she must deliver on them without any further delay or obfuscation?
Well, this government is delivering on all of these things. We're adapting our response as we learn more about this virus, which is the right and responsible thing to do. I am accountable for this government's handling of this situation, as I am for anything this government does. That's why I'm standing not just here, as I have a duty to do in Parliament, but every single day I stand and answer questions because my accountability is important and I take it very seriously. I probably answer more questions on a more regular basis than any other leader in any other part of the UK does, and rightly so in my view. But I think people would have be right to be very concerned if I was trying to take decisions that are properly those for public health experts and for clinicians. This is a team approach where we make sure we have the right approaches in place. We are building up our testing capacity. We are about to launch an extensive and significant test, trace, isolate programme that will also allow us carefully and cautiously, doing things in the right order, to start lifting restrictions. We are taking a range of measures, adapting those as we learn more about this virus to protect residents in care homes, and we will continue to take all appropriate steps to deal with a difficult and unprecedented situation. And for as long as we're dealing with this situation, will answer questions and be accountable for that. But I will work collaboratively with those who are in the health service, in the care system, our public health experts, who are all working very hard to make sure that Scotland is responding appropriately. And they certainly have my deep and long-lasting gratitude for the job that they're doing.
Question number 2, Richard Leonard.
Thank you, Presiding Officer, and can I remind members of my register of interests. Can I begin by welcoming the Government's acceptance this week of the need to regularly test staff in Scotland's care homes. We've been pressing for this since the beginning of the crisis. And can I also welcome the First Minister's announcement of a reduction in the number of new cases and deaths. But the total number of care homes reporting COVID-19 cases continues to rise, and that is why it remains an urgent priority. On the 6th of May, I once again asked the First Minister if she would commit to test everyone in Scotland's care homes, and pointed out that if we applied all of Scotland's unused COVID-19 testing capacity, we could test every one of the 85,000 people not just working, but living in our care homes in less than 2 weeks. Well, today is exactly 2 weeks on, so can the First Minister tell us if they have all been tested, and if not, how many care workers and residents have been?
First Minister.
We'll try and give the precise numbers when we're able to do that, but this is happening progressively. There is a prioritisation of care homes that have active cases, and of course we are expanding testing of staff into care homes, whether or not there are active cases and regardless of whether or not the staff have symptoms. We have expanded testing, yes, as we have built our testing capacity, although we're building capacity also with a view to test, trace and isolate, but the expansion of testing is also driven by clinical advice. And in terms of the most recent announcement that the Health Secretary has made about staff in care homes where there are no active cases and regardless of symptoms, that is driven by the clinical view that that is one of the things that can be done to stop infection getting into care homes. I think there's two other things we always have to bear in mind, and certainly clinicians always that advise us always tell us to bear in mind. Firstly, particularly with frail, older people, this is an invasive test sometimes, and can be an uncomfortable test, and therefore there has to be sound and considered reasons for doing it to residents. And secondly, that while testing is important, it can also give false reassurance, and it is really important, particularly in an institutional setting like a care home, that we don't lose sight of the basic infection prevention and control, which is the fundamental steps that care home providers have to take to ensure, as best they can, the safety of their residents. So we need to see testing as part of that, but we always have to caution, given the relative lack of reliability in tests with people who don't have symptoms, against putting all of our focus on that, because it does risk false assurance. And the last point I would make about residents, about staff in care homes, the announcement that the Health Secretary made, it's important that that is done not as a one-off. I believe, although I'll be corrected if I'm wrong, in other parts of the UK, the commitments to test all residents is a one-off test. With the staff that we will now test will be on an ongoing basis, where we will work to doing that every 7 days to give that ongoing assurance. And I think that's a really important part of what the Health Secretary announced.
Richard Leonard.
Thank you, Presiding Officer. Well, testing shouldn't be all of our focus, but it is necessary if we are to defeat this virus. And how you value a workforce is a measure of how you value a service, which is why we have been called for testing. But yet we still have no details yet of how, for example, death in service payments that NHS workers are rightly entitled to will be extended to those working in social care services. And we know that many care workers are on insecure contracts, that many are low paid. And we know that many care workers who are ill or need to self-isolate will only receive statutory sick pay. That's £95.85 a week. Gary Smith of the GMB said this week, and I quote him, "The Scottish Government should end the scandal of workers who test positive, left in poverty, if they are off work as a result of testing positive." We need to be on their side, on the side of these key workers, and so on the side of the vulnerable people they take care of. So, First Minister, this afternoon, will the Scottish Government back our proposals to support Scotland's care workers who suffer financial loss because of COVID-19, so that we can safeguard livelihoods, but also save lives?
First Minister.
Yes, we will. In response to the last part of that question, I believe that Monica Lennon already knows that, because she's been in discussion with Jean Freeman about it. So, but I'm glad to confirm that point. On the wider point, because it is really important, and let me say we are on the side of social care workers. I make a point here, and I have said repeatedly, and I'm going to say it again because it is important, we're all part of a collective effort to defeat this virus, and that is true in the social care sector as it is in the NHS, as it is in wider society. So this is not about trying to say something is one person's responsibility and not another's. We are working together. But when we're talking about the social care sector, and this is where it is different from the NHS, and I'll come on to death and service in a moment, via health boards, the Scottish Government is the employer of NHS staff. We are not the employers of social care staff, and therefore, you know, without pointing the finger at anybody or trying to pass the buck, I do think it's really important we work with employers to make sure employers are doing the right thing and fulfilling their duties towards the staff who work for them. So if you take death in service, we covered this last week. I said it was our absolute intention to make sure that the same benefits apply to people in social care as apply to people in the NHS. The Health Secretary had contacted Scottish Care. Scottish Care have confirmed that they are putting a proposal together with COSLA, and I think the Health Secretary is discussing that proposal, we haven't seen it yet, with them on Friday of this week. And if there is a role that the Scottish Government can play to facilitate that, we will play that. But it's a really important point here that employers have a duty to make sure that their staff are properly catered for at all times, but particularly in this time of crisis. And as we have done in every aspect of dealing with this, the Scottish Government will play our full part in that. And let me say, and Jean Freeman said it a couple of days ago, and it is worth repeating, that no member of staff should feel that they cannot come forward to get tested in case they test positive and then have to lose a significant part of their income. So again, these are all things that we are working with employers to try to resolve, but recognising the duty of employers, and in the exceptional circumstances we're in, being prepared for the Scottish Government to do more than we might otherwise do when we're dealing with responsibilities of employers. So all of these things will continue to be taken forward responsibly by us in collaboration with others who have a part to play.
Richard Leonard.
Thank you. The lack of fair work, which I refer to in the social care sector, is part of a bigger problem which has been identified today in a new report published by Commonweal, which calls the tragedy we have seen in Scotland's care homes as a predictable crisis. It sets out how over years the government has left responsibility for the provision of care services to private providers, while regulation and inspection regimes have been limited. And despite warnings from pandemic planning exercises of the weaknesses in social care, the government did nothing. So when the COVID-19 virus reached Scotland, we were badly unprepared. Today's report goes on to suggest that for the first 2 months of this pandemic, the Scottish Government were in denial and were too slow to take responsibility for protecting care home residents. It concludes that had it accepted this at the beginning, I quote, many lives would have been saved, and that leaving the provision of care up to providers, I quote again, almost certainly means many old people faced an absolutely unnecessarily uncomfortable and painful death. First Minister, I accept that this report is difficult reading, but it requires a response. Residents and their families want answers. Care homes have not been given enough priority, and the consequences are devastating. So do you accept that this crisis in care homes was predictable? And how will you ensure that in the roadmap you set out tomorrow, the well-being of care home residents is given the priority it should always have had?
First Minister.
The well-being of care home residents has always been a priority, and it always will be a priority. On the model of social care in Scotland, that hasn't fundamentally changed under this government. It's been in place for a long, long time. Without going into this in too much detail right now, because there is further discussion and thinking has to be done, I do think questions are being raised now about the appropriateness and fitness for purpose of that model long term. And I'm sure these are issues that we will come back to in due course as a parliament and indeed as a society. But on the here and now and on the situation with this virus, we have been and we are continuing, as are all governments across the world, dealing with an evolving situation. Our knowledge of this virus and its impacts, how it behaves, is developing all of the time. So inevitably, there will be decisions where if we had the knowledge then that we have now, we may have taken different decisions. That will be an inevitable part of assessing how this has been handled here and in other parts of the world. But you know, what I hope people accept and understand is that while it's the easiest thing in the world to apply hindsight now, we don't have the benefit of hindsight when we take these decisions. Nobody does. In due course, there will be a systemic look at things that were done and not done and lessons learned from that. We try to learn as we go along, but at every stage we take the decisions that we think are best and we take those decisions for the right reasons. That's why in respect of care homes in particular, guidance was published in early March telling care home providers what they should be doing in terms of the management of care homes to prevent and control infection. Testing, yes, we have expanded that as we've built capacity, but we've also expanded it as our knowledge of the virus has developed. One of the aspects of this virus where knowledge has developed and continues to develop is around asymptomatic transmission. So we've had to adapt our response, not just in care homes, but more generally. So, you know, I know it's always tempting for people to say this was predictable and we should have known all of this. But we absolutely learn lessons as we go and make sure we are taking the best decisions based on the best knowledge and understanding we have at the time.
Thank you. Question number 3, Patrick Harvey.
Thank you, Presiding Officer. And can I thank the First Minister for the updated figures and also add my condolences and those of the Scottish Green Party to all those who've been bereaved by this pandemic. But with the government's roadmap due to be published later this week, I would like to look a little further ahead. The First Minister has said that recovery from this pandemic must mean building a fairer, greener and more equal Scotland after the crisis. This ambition to build back better will only be realised if there is a clear economic plan and the political will to take the bold steps needed. Yesterday, after the Scottish Government blocked Green proposals to protect tenants, the Director of Shelter Scotland said it's hard to see now what is going to prevent a tidal wave of evictions sweeping people into homelessness services which were barely coping before the pandemic. So given that the Scottish Government did oppose the solutions the Scottish Greens put forward, what specific actions will the First Minister take now to protect tenants from building up enormous debt burdens, to ensure that arrears due to this crisis can't be used to evict people, and prevent this predicted new wave of homelessness after the temporary measures end?
First Minister.
We'll be, as we have done throughout this crisis, taking a number of actions, and I'm sure as a Parliament we will discuss them on an ongoing basis. Let me make a pretty fundamental point here, though. Not supporting particular amendments to a bill, it doesn't equate to a lack of determination to protect tenants. Our objection to the particular amendments were that we thought they were flawed, in some cases unnecessary, but in other cases that they would have had serious negative unintended consequences. But that does not mean we are not determined to take actions to protect tenants. Just on a couple of the points, one of the amendments called for a tenants fund. We already provide financial assistance to people who have difficulties paying rent through discretionary housing payments. We don't need to establish a new fund. Our responsibility is to make sure DHPs are properly resourced, and we will continue to monitor and do that. Then the blanket rent freeze for 2 years, discounting all rent arrears, whether or not they accrued because of this crisis. It was social landlords who actually raised concerns about that. The Scottish Federation of Housing Associations said, and I'm quoting, it would undermine and threaten the well-being of tenants, not benefit them. And the Glasgow and West of Scotland Forum described them as potentially calamitous. So, we are all determined to protect tenants. That's why the Scottish Government has already put in place the protection against eviction for 6 months. And Patrick Harvey is right. We need to consider the appropriate measures that come after that. We've given extra financial support in a range of different ways, including to Citizens Advice Scotland to help people who are struggling with rent arrears and other financial difficulties. And of course, we continue to support discretionary housing payments. So these are important discussions that the government will be very actively engaged in as we go through this crisis, making sure that as hopefully we come out of the acute phase of this crisis, we are dealing with the impacts in all of their many forms. And I hope, notwithstanding disagreements on the technicalities of amendments, we can have these discussions in an open and collaborative way.
Patrick Harvey.
I will never claim that the Green proposals are the only way that it's possible to achieve something, but if they are not the way, we need to hear from the Scottish Government what the alternative is. Because at the moment it's clear that even some landlords who can access the government's Landlord Hardship Fund may say that their tenants are increasing their rent arrears, that after that 6-month protection is over, they'll evict people on the grounds of arrears and then hike their rents for their next tenants in order to pay back the loan that they've taken out. We don't yet have the measures in place to ensure a socially just outcome. Before we went into lockdown, there were at least 10,000 people stuck in temporary accommodation in Scotland and hundreds sleeping rough. There's been an enormous effort from councils, the third sector and social enterprises to get people housed, get people sleeping rough into accommodation and moving families out of insecure bed and breakfast and into self-contained accommodation. And I pay tribute to everybody involved in that extraordinary effort. It's another demonstration of the change that we can deliver when we put our mind to it. But when the lockdown is lifted, it's critical that we don't go back to the status quo, that we build back that better Scotland we want to see. And the decisions we make now will determine whether we achieve that fairer, greener, more equal Scotland or end up making matters worse. We've got a once-in-a-lifetime opportunity to end homelessness. So can the First Minister give us a guarantee that no one will be put back on the street or into unsuitable accommodation when the restrictions are lifted?
First Minister.
Yes, I want to absolutely make sure that where we have made progress on things because of the crisis that unfortunately we hadn't made sufficient progress on previously, we do not go back the way. Patrick Harvey's talking about homelessness and rough sleeping, and he's 100% right about that, but there are many other examples from the rollout of technology in the health service and other examples as well, where out of a crisis we've done things that had proven difficult, and we've got to continue that progress and not regress backwards. In many other ways, we will have to take action to deal with the impacts of this crisis and to try to change how we do things. We've just alluded to some of the questions and considerations around the social care model in Scotland. Now, all I'd say to Patrick Harvey is this crisis has impacted literally on every aspect of life, the economy and society. And we're going to have to methodically and systematically and carefully work our way through how we fix the impacts where it's done damage and where we change how we do things in the future. So I don't have all of the answers to that right now. And I think Parliament would rightly be a bit miffed if I stood up here and tried to give you all of the answers to that right now. But just as we did at the outset of this crisis to put in place the protection against eviction, as we move into a different phase, we will have to consider what protections are appropriate for a longer term period and what bigger changes we want to see. Actually, everybody in this chamber has a part to play in that, as have the entirety of the Scottish population. I would never, ever, ever have wished the circumstances in which we're having these discussions, but it is undoubtedly the case that it gives us an opportunity to change things for the better. And that's something I'm determined to try to do, and everybody, as I say, has a contribution to make to that and a part to play in it.
Question number 4, Willie Rennie.
Last night I spoke to Linda McKenna from Tayport. Doctors at Ninewells have told her she needs her gallbladder removed, but because of the virus measures, she can only have the operation if her health gets much worse and it becomes an urgent procedure. She's on painkillers and antibiotics, but is worried that the pain will soon be back. Why does Linda have to wait until her health gets worse before she can have the operation she needs?
First Minister.
I wish she didn't. None of the steps we've had to take to deal with the immediate impacts of this virus are steps that I wanted to have to take. So to be clear, and my sympathies are with Linda, because I understand how difficult this will be for her and many others who are in a similar situation. Firstly, we had to free up capacity in our health service to deal with the immediate consequences of the virus, as hopefully we get past this first and hopefully only wave, but we can't be sure about that, that pressure starts to reduce. And the second reason was we had to make judgments about the risk to patients and whether that risk would have been greater taking them into hospital, bringing them into contact with people, perhaps exposing them to the virus, rather than allowing them to stay at home with others. So these are the immediate reasons which all governments across the UK were forced to confront and take very similar steps on. We are now, as we start to come out of this acute phase of the crisis, we are intensively planning for how we, in an orderly way and in a safe way, resume those NHS procedures, and that will be work that accelerates over the next few weeks. But those were the reasons why certain things had to be postponed. I never wanted to be in a position of having to do it, the Health Secretary didn't, but I think that people across Scotland understand the reasons for that, given the situation we were facing.
Willie Rennie.
I agree with that, and I supported the government's decision to postpone non-urgent operations because of the need to prepare for the pandemic in the way that the First Minister has outlined. But there is capacity in our hospitals to do this now. 2 weeks ago, I told the First Minister about Andrew Gould's postponed hip operation. Mr Gould now tells me he is finding it difficult to walk. Professor Andrew Elder from the Royal College of Physicians of Edinburgh said, "I believe that we must now move swiftly and carefully towards restoration of deferred or delayed activity." But that was 3 weeks ago. I know the First Minister understands that the very measures we have taken to protect us from the virus are causing pain and harm in many other ways. So in advance of her statement on easing the lockdown tomorrow, can she give the thousands of people waiting for treatment any hope today?
First Minister.
The phrase swiftly and carefully is absolutely the one that we plan by. This work is underway. We will seek to resume NHS procedures that have been postponed as swiftly and as carefully as possible. The immediate pressures in the form of hospital and ICU admissions, from the statistics I give every day, has been reducing. But I know from people working in the health service that I speak to that the pressure of dealing with this virus has not gone away, and there are still significant concerns in our hospitals, as there are in care homes, which we are seeking to manage and get on top of, as all of the governments across the UK are doing. There are still concerns about nosocomial infection, about the transmission of this virus in hospitals. So we have to be careful and safe about how we do this, but getting those procedures underway again is a priority, and as I say, that work is underway. That is part of the route map. We will set out in broad terms the phasing of what we're trying to do, but at every phase of what we're trying to do over the next weeks to get back to normality, bringing the health service back into normal operation is absolutely at the heart of that. Of course, as I alluded to a moment ago, there will be things about how the health service used to operate that we might not want to just go back to, because there has been a greater focus on technology, a greater focus on remote consultations. In some cases, we may want to continue operating like that because it's things we've been trying to do for a long time. But getting people who need treatment, access to that treatment as quickly as possible is absolutely essential, which is why it is such a key strand of the work we are doing to get the country back to normal.
Question number 5, Alec Neil.
Thank you very much indeed, Presiding Officer. Can I ask the First Minister what plans the Scottish Government has for rolling out the new antibody test for COVID-19 in Scotland?
First Minister.
Antibody testing is currently being used in Scotland as part of our community surveillance programme. The sensitivity level of these tests has meant that to date they have only been useful for providing population level information, but with the ongoing validation of new, more reliable tests, we are drawing on clinical and scientific advice to quickly develop plans on how these will be best deployed. We're engaging on this testing with the other administrations as we all work as quickly as possible to bring this new approach to testing forward.
Alec Neil.
I thank the First Minister for that answer. Can I specifically ask about the new antibody test that is coming on board and ask what impact that will have in the testing, tracing and support strategy, and which will be the priority groups for the new antibody test?
First Minister.
The new antibody tests, because of their greater reliability and sensitivity, they allow us to move away from a population surveillance use of these tests, hopefully into use with individuals. Test, trace and isolate will fundamentally be based on diagnostic testing, but as we go forward, antibody testing will have a greater part in our overall strategy. Plans for this are in development. We hope to set them out soon. As we learn more about antibodies and immunity to the virus, that will inform how we use these tests best as we move forward. Some of the recent news on the development of tests has been very, very positive, but I think it's still really important to inject a note of caution here. The evidence has not yet developed sufficiently to tell us that when or at least to give us assurance that when antibodies are detected, that it signifies necessarily meaningful or long-lasting immunity. So there are still big questions about the extent to which and the longevity of the immunity you get from antibodies. So that's the cautionary note I would strike, but these tests, I hope, will help us and have a crucial role to play in helping us both to answer that question and in our long-term strategy of dealing with this virus.
Question number 6, Brian Whittle.
Thank you, Presiding Officer. To ask the First Minister what the Scottish Government's response is to reports that obesity and diabetes increase an individual's risk from COVID-19.
First Minister.
There are signs that do suggest people living with obesity and diabetes may be at risk of poorer health outcomes from COVID-19. A review looking at this and other potential factors is being conducted, and it's due to report, I understand, by the end of the month, and we will be guided by evidence in assessing the continued risks from the virus.
Brian Whittle.
Can I thank the First Minister for that answer? I think with so many conditions, such as heart and respiratory conditions, as well as diabetes and obesity, increasing the risk from COVID-19, which in turn has led to an increased mortality rate, does the First Minister agree with me that this crisis starkly highlights the need to tackle Scotland's poor health and inequality report card, and that a step change in how we view and deliver health moving towards a more preventative agenda is long overdue?
First Minister.
Yes, I do agree with that. We already have a delivery plan in place to address the challenge of overweight and obesity. Adult weight management services across health and social care have been maintained where possible and continue in various formats, including through the increased use of telephone and video calls. But this is another reminder of the need to be as preventative as possible in our approach to health and deal with some of these underlying risk factors that make people more susceptible to becoming seriously unwell if they get particular illnesses. We still need to understand more about the impacts of this particular virus, and what the other risk factors are is one of the aspects of our knowledge about it that is continuing to develop. But I have little doubt at this stage that it will add to that understanding of the need to prioritise healthy weight and obesity and tackling those. And I look forward to, amongst a whole range of other work streams, that getting back to normal as quickly as possible.
Question number 7, Pauline McNeill.
Thank you, Presiding Officer. To ask the First Minister what analysis the Scottish Government has made regarding the potential impact of the COVID-19 outbreak on women's position in the labour market.
We continue to assess the impact of COVID-19 across the population. To this end, we recently published an analytical paper examining the expected labour market impacts on different groups, and that included women. The paper shows that women are more likely to work in many of the shutdown sectors and are more likely to have caring responsibilities, which can make it hard to maintain or take on employment in the current crisis, with potential consequences on their income. We take issues around women's employment very seriously, and that's demonstrated by our other various policies in support of women, including the Gender Pay Gap Action Plan, the Women Returners Fund, which of course sets out 60 actions for tackling barriers faced by women in the labour market.
Pauline McNeill.
I thank the First Minister for that answer and welcome the work that the Government are recognising that the disruption to the labour market caused by the coronavirus pandemic will have a disproportionate impact on women, and that's also acknowledged in a report by advocacy charity Close the Gap. But the sectors that women are more likely to work in, such as food service and retail, have been hardest hit by the virus. A lack of consideration afforded to gender in the aftermath of the financial crash in 2008 resulted in the recession having a disproportionate impact on women. So that's why I do welcome that the Government have recognised this particularly. But I ask the First Minister we should continue to take a gendered response to the anticipated jobs recession with other interventions designed to address women's inequality. And in areas such as social care and childcare, I mean, I'm sure she'll agree with me on this, that women's work is undervalued and they are dominant in that sector. Would you start the process by supporting levels of pay in those sectors? At least that would value the work that women, until we can make deeper progress on occupational segregation for women.
First Minister.
On the pay issue, yes. I mean, one of the many reasons we support so actively the real living wage is to try to ensure that in some of the jobs that women are more likely to do, we see pay reflecting what they do, although I still think we have to go further than that. It's also why, for example, seeing the long-running equal pay injustice resolved in Glasgow and in other parts of Scotland was so important in recent times. But I do agree with Pauline McNeill. I think it is important that we do have a gendered analysis of this, not just the immediate impacts of this crisis, but the actions we will take to recover from it. The analytical paper I spoke about in my initial answer is worth reading for those who are interested in this. It doesn't have anything that will hugely surprise people, but it does really underline some of the issues that we are dealing with here. Women do more unpaid care work and take more responsibility for childcare. That makes it harder for them to maintain or take on employment. Women are overrepresented in health and social care jobs, which over the past couple of months will have put them at greater risk, of course, of contracting the virus potentially, and that is particularly true potentially of women from African, Caribbean or black ethnicities. Women are also the vast majority of lone parents, and lone parents are less likely to have somebody to share childcare with. So these are just some of the issues that this analysis lays bare. And as we decide on the actions we need to take, we announced some significant funding yesterday to try to start considering how we get people back into the labour market after this crisis abates. But we need to consider in particular the challenges and the barriers that women face, and I give an assurance that that is exactly what we will continue to do.
Question 8, Liz Smith.
To ask the First Minister what action the Scottish Government is taking to ensure that all answers to written parliamentary questions about COVID-19 are being processed as quickly as possible.
First Minister.
We aim to answer all parliamentary questions as quickly as possible and within the deadlines agreed with Parliament, and the vast majority are answered on time. I think it is only fair to recognise that the significant redirection of civil service resources to respond to the pandemic does inevitably mean that there might be an impact on response times, but we will do all we can to minimise any such impact, as we recognise that accountability to Parliament is even more important in these exceptional times. And that's why, in addition to continuing to respond to written parliamentary questions, the Government has also provided information to members about the range of ways to obtain information from the Government, specifically about the pandemic and our handling of it.
Liz Smith.
Thank you, First Minister. On Monday this week, the Parliamentary Bulletin reported that of 93 written parliamentary questions submitted specifically about COVID-19, no fewer than 22 holding answers were issued. At the weekend, we learnt last week, one ministerial department delayed answers on 30 occasions. One MSP intimated that they had received 12 holding answers on one day, and another MSP intimated that she had received 5 holding answers in one day. Can I ask, First Minister, and I ask this on behalf of many members across this chamber, does the First Minister accept that this is a completely unacceptable situation at a time when members are urgently seeking important information to give to their constituents?
First Minister.
Well, I do understand the importance of rapid answers to parliamentary questions. I'm not for a minute going to suggest that it is not really important, and we will try to make sure that those answers are given timeously. I simply make the point, everybody across government is working incredibly hard dealing with an unprecedented and very difficult situation, and I simply ask, not for members to accept that that means questions don't get answered, but just to make a little bit of allowance for that reality that we're facing right now. It is also the case that in some, and I can't say that this is the case for the holding answer that Liz Smith is talking about specifically, but in some cases it will be the case that information is maybe not always readily available. We are learning about this virus, we are developing and deepening the data sources that we're publishing, so there is also, on some cases, there will be a need to take a bit longer to get the information that members are asking for. But what I would say is, in addition to recognising the importance of answering written questions as quickly as possible, we have made available a range of other ways to obtain information from the government, and I would encourage members to use that. I also think it's really important that we answer questions in this format. There have been a range of virtual question times with ministers. I'm answering questions here rightly, as is my duty, for an hour today. I'll be answering questions for an hour tomorrow in Parliament on the publication of the route map. I answer questions not from parliamentarians but from the media for an hour every single weekday. So I do recognise the importance of information, particularly at a time like this, and the importance of accountability, and we will continue to try to improve as much as possible. In return, I just ask for a little bit of understanding about the multitude of pressures that the people with responsibility of answering these questions are working under right now, which I hope anybody, any reasonable person, which I know includes Liz Smith, would recognise at this time.
Thank you. And there are a huge number of supplementaries yet again today. We're not going to get through them all, but we'll run till just after past, around that time. Bob Doris to be followed by Rachel Hamilton. Bob Doris.
Presiding Officer, like the rest of us, sporting clubs are eagerly awaiting details of the route map for a gradual easing of lockdown restrictions. Sports clubs such as football clubs have understandably caught the headlines. However, local sports clubs right across Scotland, such as lawn bowling clubs in my constituency, and I should note there are 900 clubs with 60,000 members right across Scotland, are hopeful that they may be supported to reopen safely with social distancing protocols strictly enforced and put in place. A member of Hawthorne Bowling Club in my constituency told me of the physical benefits and the important camaraderie that sport offers patrons. Does the First Minister agree with me that during Mental Health Awareness Week it is right to acknowledge the mental health benefits of club sports? And will the Scottish Government look at the case of adding lawn bowls to the list of permitted sports with strict social distancing, of course, as we gradually ease lockdown restrictions?
First Minister.
Well, yes, I do recognise the mental health benefits of clubs and team sports and getting together with people. So, yes, that is a really important consideration. I also recognise the mental health benefits of exercise, which is why the first easing of restrictions we did make was to allow people to exercise more than once a day, which had been the restriction up until then. So we look very carefully at all of these things. I'd simply say this, and I don't take any pleasure in saying it, it's just the reality that we are still in. We have limited room for manoeuvre right now. That's what the data tells us, and therefore we have to be careful and cautious. We will not be able to immediately give the green light to everybody and every organisation that wants to open. We have to do that in a careful way, in a phased way, and with some clear priorities. There will be, I think, as we move through the next weeks, it will be easier to open activities that happen outdoor than it will be to open activities that happen indoor. And it will also be really necessary for us to continue to maintain safe social distancing. So there are clearly some restrictions and constraints that are going to be with us for some time to come, but within those we will try to get people back to normal back to as much normality as quickly as possible. The final point I would make is one I think I made last week. We have to get the right balance here. I am as desperately keen as anybody is to get the economy moving again. But we also need to recognise when we've got limited room for manoeuvre, we have to recognise the need for people to have more social interaction as safely as they can, as well as getting people back to work. So these are all the balances that we're trying to strike in the best and safest way possible.
Rachel Hamilton to be followed by Alec Rowley.
Thank you, First Minister. Presiding Officer. First Minister, yesterday, OVO Energy announced that it will completely close its Selkirk office in my constituency, and the cuts will see 380 staff affected. It remains unclear how many jobs will be lost entirely, and these job losses are devastating for a fragile rural economy like the Scottish Borders, and the young people in particular will be affected acutely. Can I ask the First Minister what the Scottish Government's response is to these job losses? And in the pandemic lockdown, will the PACE services be operating as normal to support these devastating job losses and many cuts in the OVO losses to my constituents?
First Minister.
Can I thank the member for that question? And I deeply regret, as I know she does, the announcement from OVO Energy, which has a huge impact in Selkirk, but also has an impact in Perth, for example, where there is also people employed by this company. We will, through Scottish Enterprise, continue to engage with this company or any company facing a similar situation to consider if there are actions we can take to prevent or mitigate redundancies. But I can also give an assurance that we will also make sure that PACE is operational. It may, as everything else does right now, have to operate in a slightly different way to maintain safe working practices, but that support will be available for people who are facing a redundancy situation, because that support is going to be even more important in the weeks and months to come than it has been even in the past few years. So that assurance is one that I will give, and the Economy Secretary will continue to be very open and happy to discuss individual situations like this with members whose constituencies and constituents are affected.
Alec Rowley to be followed by Christine Graham.
Thank you, Presiding Officer. The First Minister said that it's important that we get the economy moving again, and I agree we are facing a real crisis as we move forward. The GMB Scotland have stated this morning that they understand that SSE Renewables is currently intent that work for the Seagreen offshore wind farm will become the latest tranche of offshore wind farm work to go abroad, despite the huge support this industry received and receives from the UK taxpayer. That means that yards in Burnt Island, Methil and Stornoway are likely to remain empty, whilst the work for offshore wind farms around Scotland goes abroad. Can the First Minister say what action the Scottish Government is taking to bring work for the Scottish offshore renewable sector to Scotland and get work for these yards that are lying empty?
First Minister.
Well, it's an important issue. As the member is aware, the Scottish Government established the task force and the summit to look in detail at the barriers and the issues there, and there's been good cooperation, obviously hampered as many other things have been with this crisis, but good cooperation between companies, developers, the Scottish Government, the UK Government and trade unions. We want to continue that approach. My understanding is that no decisions have yet been taken by SSE in respect of this project, but obviously that is likely to be a rapidly moving situation. I have personally, as has the Government generally, engaged with SSE over these issues in the past, and we will continue to do so to make sure that as much of the economic benefit from our vast renewable energy resources comes to Scotland as possible, and that will be an ongoing priority for the Government and for the Economy Minister in particular.
Christine Graham to be followed by Maurice Corrie. Christine Graham.
Thank you very much, Presiding Officer. Can I, First Minister, have clarification as to whether the guidance to the construction industry has changed? As I'm aware of several instances of construction work in my own constituency where proceeding, they're observing social distancing and so on, but they're certainly, according to the current guidance, they're on the non-essential list and are therefore banned. So can I have some clarification, please?
First Minister.
Guidance to business has not changed, as I think I said a couple of days ago, and we'll say more about tomorrow after we publish the route map tomorrow. We will, over the next days, publish sectoral guidance that tells companies within key sectors the steps they need to take to prepare for a safe return to work. It's not necessarily that all will be returning immediately, but will allow companies within key sectors to start that preparatory work. There has been particular engagement with the construction sector. The construction leadership group itself has prepared a phased approach to restart, which I'm sure we'll say more about tomorrow. We want companies and workers to get back to work as quickly as possible, but it is essential that we do that safely. I come back to a central point that I know is easy for all of us to forget in our anxiety to get things moving and get back to normal. But we really would be making a huge mistake if we moved too quickly and allowed this virus to run out of control again. And that is still a real and present danger. And that would be damaging for the economy, as well as undoubtedly leading to more lives lost. So I will make no apology for continuing to take a very careful and cautious approach, and also one that aligns with our introduction of test, trace and isolate, because that will become a key part of how we keep the virus suppressed as we get more people back to work. But just to clarify and repeat, the current guidance to business remains in place and has not changed.
Maurice Corrie to be followed by James Kelly.
Presiding Officer, one of my constituents who's in remission from stage 4 prostate cancer has undergone treatment for early stages now as skin cancer and has begun tests for bowel cancer. He has been waiting further tests since early February this year, despite his own GP marking his case as very urgent. My constituent has received a letter postponing these life-saving tests indefinitely, causing a great deal of worry and concern and stress. Can the First Minister today answer as to why so many urgent cancer cases, such as this one, have still yet to receive testing and treatment?
First Minister.
If something is urgent, it should be going ahead, and I and the Health Secretary have made that clear. But there will be clinical judgments that have had to be made in recent weeks about whether the risks of going ahead outweigh the risks of postponing for a period. I can't comment on all of the individual cases there. I'd be very happy to look into the particular case if the member wants to send us the details, but that is the general position. But as I said in response to Willie Rennie, we are now in a process of resuming hospital procedures as quickly and as safely as possible. But anybody who has had any kind of procedure postponed, I know how difficult that will be. I know how in some cases worrying that will be and indeed painful in some cases. But the clinical judgment that will have been made there is that on balance is less of a risk than going ahead. That doesn't make it any easier for the individuals, but I just want to make the point that none of these decisions are being taken lightly right now at all. And as soon as we can safely do so, we want to get the NHS operating as normal.
James Kelly to be followed by Linda Fabiani. James Kelly.
Thank you, Presiding Officer. Can I draw the First Minister's attention to the referral of Police Scotland to the Health and Safety Executive by the Scottish Police Federation for inadequate protection of officers carrying out breath tests? The Police Federation state that the procedures do not represent best risk management. Clearly, a referral to the Health and Safety Executive is a serious matter, and it's unacceptable that officers should be put in this position. So will the First Minister direct Police Scotland to find a solution that ensures that officers feel safe carrying out these important duties?
First Minister.
If I was to stand up here and issue a direction to Police Scotland on operational matters, I think rightly James Kelly would probably be one of the first to say how inappropriate that was. The procedures for taking evidential breath tests are a matter for the Chief Constable. However, clearly there are important issues to consider here. So I've seen the reports that the SPF have referred the matter to the Health and Safety Executive, which they are absolutely entitled to do and right to do if they have concerns. And I would encourage both the Federation and Police Scotland to continue their dialogue about this issue in order to resolve it. The Justice Secretary regularly meets with the Chief Constable. I have regular discussions with the Chief Constable to discuss the entirety of the policing response to the virus, and that of course does include and impinge upon issues of health and well-being of officers and staff. But on this very important issue, I would encourage continued dialogue, and of course any views that the Health and Safety Executive have on this must be of course taken into account.
Linda Fabiani to be followed by Ruth Davidson. Linda Fabiani.
Thank you, Presiding Officer. To ask the First Minister what steps can be taken to make sure that employers in Scotland who claim funds from HMRC under the Coronavirus Job Retention Scheme act within the spirit of this scheme and disburse the funds in full to eligible employees, and indeed what penalties could be imposed should malpractice be found?
First Minister.
Well, I think it's important that any company accessing funds at this time does so appropriately and that no one seeks to abuse the system. Obviously, for schemes administered by HMRC, that would be a matter for HMRC in terms of the monitoring and any penalties to apply there. The Parliament this afternoon, I know in the context of the coronavirus bill, will discuss amendments from, I think, Patrick Harvey around Scottish Government funding and not making funding available to certain companies who don't comply with their tax responsibilities. So these are really important ethical matters. This is a crisis. Taxpayers' money has been rightly made available, but it's really important that companies do not abuse that. In my experience, the vast majority of companies are acting perfectly responsibly here, but it is important that we make sure that even if it is a tiny minority that seek not to do so, that there are appropriate procedures in place.
Ruth Davidson to be followed by Andy Whiteman.
Thank you, Presiding Officer. 2 weeks ago, I asked the First Minister about publishing a roadmap on reopening IVF services in Scotland, since they're already...
Would the member just pick her microphone up? Sorry.
I've never been accused of being quiet before, Presiding Officer, but let me start again. 2 weeks ago, I asked the First Minister about publishing a roadmap on reopening IVF services in Scotland, since they're already able to be up and running elsewhere in the UK, and I look forward to one being forthcoming. But the very fact of asking that question prompted other worried couples to come forward and contact me about their own situation, and one concern that's recurring has been that in Scotland you're entitled to 3 rounds of IVF on the NHS if you're under 40, but as soon as you hit 40, that's cut to 1. Can the First Minister reassure women who are in danger of having their entitlement cut that no woman will be penalised for crossing the age threshold due to the suspension of services during COVID, however long Scotland's clinics stay shuttered?
First Minister.
Well, on the general issue about restarting that, I'll ask the Health Secretary to write to the member to give more detail on exactly where that is and the progress that has been made on that. On the second part of the question, in general terms, yes, I will give that assurance. I'm happy to get the Health Secretary to, again, give more detail as to exactly how that will work. But I don't want any woman who is undergoing IVF to have their chances of conceiving a child taken away from them because of this crisis alone. And we will do whatever we can and whatever needs to be done in order to ensure that's not the case. But if the member will bear with us, I will ask the Health Secretary to write on both of these points with more detail about how we'll put that assurance into practice.
Andy Whiteman to be followed by Alex Cole-Hamilton.
Well, thanks, Presiding Officer. The First Minister might be aware of a letter from the House of Commons Science and Technology Committee to the Prime Minister of 18th May outlining lessons learnt to date in the COVID-19 pandemic. Recommendation 2 is that there should be more transparency in the scientific advice provided to government, including that there should be a summary of advice. And I stress advice. I'm not talking about evidence. I'm talking about advice. A summary of such advice should be regularly published. Now, I know this is not a routine practice, and I would agree in normal times advice to ministers should not be published. But does she agree in these particular circumstances that would aid transparency and help scrutiny of government decisions?
First Minister.
I'm happy to look at any suggestions about how we both increase transparency but also assist public understanding of the challenges that we are dealing with and the evolving nature of our government's understanding of this virus. Certainly in terms of the expert advisory group that has been established in Scotland, the CMO expert advisory group that provides really important advice to me and to other ministers. The minutes of their meetings are already published on the Scottish Government website. The membership of that group is published because it's really important that people see the names of those who are providing us with that advice. But as we go through this, we will continue to put as much data into the public domain and to provide as much understanding of the decisions, what underpins the decisions we're taking as possible. I know, for example, and I know it's only a tiny example of what the member is talking about, at least I think this is the case, that members had a briefing yesterday with the Government's Chief Statistician to give a deeper understanding of how the R number is calculated and the factors that are taken into account. So we will continue to try to aid that understanding as much as possible in as many ways as possible.
Alice Cole-Hamilton, to be followed by John Mason.
Thank you, Presiding Officer. Earlier this month, Neil Findlay submitted a question asking for the destination of those patients discharged from hospital to make way for an influx of COVID patients on every day since 1st February. The answer given this morning revealed that 29% were discharged to care homes in the month of February. But, Presiding Officer, that answer covered February alone. What happened to those older patients moved out of hospital in that great exodus in March and April could prove critical to our understanding of the tragedy now sweeping through our care homes. So can I ask the First Minister, what has happened to the data from March and April, and will she commit to publishing it now?
First Minister.
I will stand corrected if I'm wrong here, but I think the Health Secretary gave that information in the chamber yesterday, where she said overall 62% of people discharged from hospital had been discharged with an appropriate care package to their own home, and 38% had been discharged to a care home. So I believe that information was given in the chamber yesterday. If not, then I've given it now, and we can put that onto the parliamentary record in other ways as well. One thing, I actually do agree that these are really important issues as we consider the decisions that were taken and the reasons for those decisions. This is a really important issue to have under consideration. I would remind members, though, that when any patient resident was being discharged from a hospital into a care home, the guidance that was in place in that for care homes about isolation and infection prevention and control, it was not ever the case that these weren't important considerations when residents were being admitted to care homes, or indeed for residents already in care homes. But I hope that information in terms of the numbers is answering the question Alec Cole-Hamilton posed, but if not, we'll provide other data if we're able to.
John Mason, to be followed by Jackie Bailey.
Thank you very much. The First Minister mentioned earlier that activities taking part outside are generally safer than those taking part inside. So can't you give any guidance about the government's thinking? Say an activity could take place in either place, like a wedding. Would it be possible to lift the restrictions on weddings outside before necessarily inside?
First Minister.
I'm not going to give an absolute guarantee to do that specific thing. In general terms, outdoor the risks of transmission outdoor appear to be lower than the risks of transmission indoor, but of course even outdoor there are considerations about social distancing that have to be taken into account. And clearly, while I absolutely understand why people want to see weddings able to go ahead as quickly as possible, in intimate family gatherings there will always be concerns around social distancing and transmission risks because of that. Wedding and civil partnership ceremonies are restricted by the current regulations, and that includes the restrictions on gatherings in a public place. Allowing marriages and civil partnerships more generally to go ahead isn't yet supported by the scientific and medical evidence, but we will look at, for example, extending the practice of some ceremonies taking place in private spaces like gardens and the outdoor issue in more detail. So I absolutely see where John Mason is coming from, but we have to, in all of these issues, consider all of the relevant factors and move as swiftly as possible, but as carefully and as safely as possible as well.
And Jackie.
First Minister, in week commencing 24th of February, at the same time as the Nike conference in Edinburgh, senior staff from Scottish Development International assembled for a week-long conference of events at Scottish Enterprise offices in Glasgow. These staff were not just from Scotland. They came from America, they came from Asia, they came from all over the world. Given that COBRA meetings had been taking place since January, underlining the seriousness of the coronavirus pandemic, it is surprising that Scottish Development International didn't postpone the event. Is the First Minister aware if anyone that attended that event was suspected of having COVID-19? Has there been any follow-up testing of those who were there? And does she think it shows poor judgment for a government agency to ignore the warnings about the pandemic and organise a global event?
First Minister.
I don't think that would necessarily be a fair characterisation of the decisions that we're taking. I am not aware of having knowledge of this event, so I certainly wouldn't be able to answer the questions about whether anybody there was suspected of having coronavirus or not, but I will certainly look into that, and if there is any further information that we're able to give to Jackie Bailey, then we will make that available. But you know, decisions around mass gatherings, decisions around the further restrictions that were put in place were taken at what we consider to be the right time and in the right order and in the right way. I'm sure there will be for a long time to come questions legitimately raised about whether that was the right order in which to do things or whether things should be done earlier. And you know, but none of us have hindsight when we make those decisions. But in terms of people coming into the country, of course, border control is not a matter for this government, and I think we will see some decisions on border controls going forward. But we try to take all of these decisions in a proper and measured way, and that applies to government agencies as well as to the government itself. But if there is more information we have about the particular event that Jackie Bailey is raising, I'll endeavour to get that to her.
Thank you very much. And that concludes First Minister's questions. Can I encourage members to leave safely, observing social distance, and we will resume at 2:30. Parliament is suspended.